for Peoria City County Health Department, and welcome today, Friday, March 13th, daily briefing in our response to the COVID-19. As usual, trying to start off with giving some feedback about where we are in terms of Peoria's county. Similar to yesterday, we are still sitting at 0 positive confirmed cases, 2 negatives, and actually 1 currently pending. Our total number of investigations is 3, which is a drop from yesterday, and that's because the case that we had started investigation of is actually from a county outside of Peoria, so it was transferred over to that county for follow-up. Currently, we are working on a lot more feedback in regards to social distancing, as well as looking at limitations on sizes of events, as well as trying to control the scale of gatherings here. That's really the next phase of our response plan in terms of really, again, flattening that curve and trying to extend this out to not create a burden on our healthcare systems. We have different entities that have issued various responses to how they are working to control this. And today we actually have Sheriff Brian Asbill to discuss in further detail how specifically the Peoria County Jail is working through this process to look at different control measures as well. So I'll let Brian come and speak to us.
Good afternoon. Just follow up on what Monica just stated. We have put some precautionary measures in at the Peoria County Jail, as well as Chief Judge Gil Fallon has put some restrictions at the courthouse, which came out earlier today. For the jail, we have just restricted all non-essential employees, volunteers from entering the building. So we're stopping pretty much all programs and services internal to the building. However, we'll still work with the law enforcement agencies within Peoria County to address anyone that comes to the jail. No one's going to be turned away from the jail. Actually, we have a structure that's built for quarantine if needed. At the courthouse, we will be limiting entrance to anyone that exhibits signs. We'll be having at their screening points to identify individuals that might be infected. Again, this is all what-if scenarios. So at that point, they would be asked to leave. There's phone numbers that went out on a press release earlier. If someone is scheduled for court, they can call in, and that way we avoid any failure to appear situations. Be more than happy to answer any questions. Thank you.
In addition, we do know that there's going to be continued restrictions being placed in a variety of settings. Nursing homes have already started the process of visitor restrictions. Our hospital systems are working through their policies. They're already still under visitor limitations for influenza, but looking at how to progress that in response to COVID-19. With that in mind, we do have representatives from the hospital here to answer any of your questions. We do recognize that the governor is set to speak at 4 o'clock and wanted to make sure that we had available time to allow for our media here locally to make sure they can cover that as well. Post the governor's briefing, and you're more than happy to stay here and watch it with us, we will have not only myself, but representatives available to answer questions, representatives here to answer questions, including the sheriff, county administrator Scott Sorrell, as well as Regional Office of Education Superintendent Beth Kreider.
What I would like to ask is we have been hearing a lot about self-isolation. A lot of folks now, because it's going on and on and on, there are people who may have come in contact with someone who may have come in contact, who may have come in contact. Who are the people who should be keeping themselves under quarantine if they show no signs? Let's say no fever, no cough, none of that, and it's been a week. Can they come out or no or what?
So the question was in regards to those individuals that are needing to do self-quarantine based on their contacts or exposure to various contacts. So right now, in terms of self-quarantine, and again, a quarantine is an individual that has not been confirmed to have an illness, but might have been exposed to it. Those are really based on their exposure to those high travel areas or those level 3 areas, as well as to an individual that has been tested in a confirmed case. And so those are where we're asking for the self-quarantining to happen. Now, different employers, based on travel, might institute and ask their employees to do additional quarantine, and that can be a personnel policy based on those agencies. In terms of individuals that might have been a contact of a contact or even further along, we work with the healthcare providers to assess them, and then based on that, we ask them to self-monitor their symptoms if anything changes. But if they are not, again, one of those individuals that were traveling from one of those designated areas or have been with a known contact that's tested positive, they don't necessarily have to self-quarantine. We just ask that they monitor their symptoms so that if it does change, they need to contact us as well as their healthcare provider.
Monica, you mentioned how one case is from another county. Are you able to share what that other county is? Is it here locally in central Illinois?
No, it is not.
There's been kind of speculation amongst the general public as to some kind of set places where this testing is going to start taking place regards to certain OSF locations. Do you have any details on that?
I can ask our medical individual here to talk a little bit more about it, but the hospitals do have plans in place for where to collect specimens. Again, there is no localized testing in laboratories. All specimens are collected here locally, but then sent out to whether an Illinois Department of Public Health lab or some private labs. We are working with all the healthcare providers to let them determine within their own system operationally what makes sense to them. Some are designating specific clinics. Others are looking at models where they go to the homes and collect them specimens at those locations. But it varies by the operational capacity and scope of those healthcare providers, what makes sense in their model and what's the best.
Okay, when it comes to testing, obviously there's not a whole lot of kits, and obviously we have heard that to go to your PCP and to try to get all that worked out there. But that's still creating a great deal of uncertainty. We're now four days in, and for the average person, that is a lifetime. What could you say to the average person who's been hearing all this but still feels upset? They are still. I mean, there's a palpable fear out there. So what I'm asking you is, obviously you can't change things, but what can you say to maybe put it into terms that they can get?
So I will answer the question in regards to the testing, but I think in terms of your clinical and how individuals that are low risk, how they can self-isolate and take care, I'll actually refer to our physician that's here to answer those questions. But in terms of testing, there is limited amount of testing, and we need to make sure we are prioritizing that testing, especially with our state labs. The private labs are allowed to, if the provider determines to utilize them for non-priority testing, but for the state labs, we are still utilizing a prioritization. And the main reason for that is understanding those risk levels, as well as individuals that are high risk to get secondary infections that lead to pneumonia or other things that we see the fatality rates associated with. And so we are still prioritizing testing. Private laboratories are now available that can allow non-prioritized testing to happen, but we really want individuals to consult with their primary care provider for twofold. One, because there is no vaccine and there is no medication that will stop this. Your best course of action for a majority of individuals will be to stay home, self-isolate, and manage their symptoms. So that's fever reduction, rest, and water. Having said that, we understand the concerns that individuals would like to know, but we want to make sure those testing is available for that high-risk population that we are discussing. And so with that, maybe you can share kind of in terms of the symptoms as well.
Thank you, Monica. Thank you, Monica. Regarding the testing, we're
Name, please.
Samar Seder. I'm the Chief Medical Officer with Unity Point Health for the Peoria region. Regarding the testing, we have other resources in healthcare that are limited. And when those resources are limited, we have to make a decision, when does that resource give us the most bang for our buck? I'll give you an example that everybody is very aware of. Kidney transplants or heart transplants or liver transplants are regularly restricted because we can't give one to everybody. Currently, there is a restriction on the testing. We want to use it for the people that we're most suspicious for. And that's what we're doing as a healthcare system and following the recommendation of our colleagues in the health department. If you come to the hospital and you're ill and we cannot figure out why your lungs are not functioning normal, we will get the testing done. And that fits under the criteria. But if you're home and you have the same flu symptoms of influenza A or influenza B, we want you to do the same thing. Whether you have influenza or COVID-19, it makes no difference. You should isolate yourself. You should attempt not to infect other people. And most of the time, especially younger people, will do just fine. For the very small percentage that will not do fine, where they have severe respiratory symptoms, those are the people we want to test, especially if they're in the hospital.
So I want to make sure I heard that right, because I was listening to Monica, and the sense, sir, that I got was, if you're a younger person and you came in contact on a tertiary basis, it's 3 times removed from someone that might have, that someone might have. After a few days of checking, you could go outside and you're fine, you can live your normal life. I thought you just said, though, if you have flu signs, symptoms, you should stay inside. So it seems like what you're saying is the rule of thumb on self-isolation is, when in doubt, if you show signs, stay in, right?
Yes, if you have symptoms, you stay in and you self-isolate. If you don't have symptoms, you don't have to self-isolate. You do monitor, follow the social distancing rules that we've been talking about, handshakes, washing your hands, staying away from people who are high risk. You can do that. When you're symptomatic, you're in a whole different bucket. And when you have symptoms, fever, cough, shortness of breath, runny nose, we want you to be more proactive with that isolation.
Is the local healthcare system, if there is a positive case here, is the local healthcare system able to absorb the impact if, say, doctors and nurses come into contact with that patient and they're also forced to self-quarantine or isolate?
Yes, we have plans for what happens when a patient comes in that may be a COVID-19. We've already had those patients. Both hospital systems, and I'll speak a little bit for my colleagues at OSF, we are ready to take care of these patients. We know how to do droplet isolation. We do it frequently for influenza, for tuberculosis. This is not something that we're not used to doing. What we're trying to prevent and what we're trying to prepare for is the avoidance of that big peak of a large number of patients coming in. And when you have things like schools closing, when you have employers who are changing what they're doing, that includes us, then we have to think about how do we staff our hospital from the entrance to the physician. So we have to think about all those things. That's why our emergency command centers are open.
Can you give an example of what kind of changes or adjustments you are making?
Well, maybe I can answer that.
Yep.
I think this will be going out shortly as well, but Unity Point Health, OSF Healthcare, and Hopedale Medical Complex will be going on to visitor restriction. And in that case, visitors are limited to 2 adults, age 18 and older, per patient at one time and in most circumstances. Visitors under the age of 18 may visit only if they are immediate family member and are considered by the patient's healthcare team to be essential to the patient's well-being. All visitors must be healthy. We strongly recommend you do not visit if you're displaying signs or symptoms of an influenza-like illness, which includes a fever greater than 100 degrees Fahrenheit with cough or sore throat. If you show these symptoms, we are going to be asking you to leave. Out of the respect of patients, staff, and other visitors of certain symptoms will also be asked to postpone their visits. Some patient units, clinics, or diagnostic centers and treatment areas may already have additional restrictions that are used to protect the type of patients that they serve. So this restriction is, again, it's a higher degree than is currently being done in our facilities, and that'll be implemented by Unity Point Health in the Central Illinois region, as well as OSF St. Francis Medical Center and Hopedale Medical Complex.
Is that effective immediately?
It is.
I know one of the, with the President Trump declaring a national emergency, one of the things that he discussed that can be implemented because of that is that hospitals can limit stays to 96 hours. I know yesterday the doctor talked about, kind of the whole issue with this is having enough beds available because there are still the other medical emergencies. I guess how is the hospital looking at prioritizing, this with those other normal medical emergencies we have if hospital stays can be limited?
I think that's a great question. I think that's why those emergency powers come into play, because it does allow us to give more flexibility to our providers to actually assess them more so and within their determination to discharge appropriately. And so those type of activities that allow for changes in regulation as well as resource allocation improvements are what these type of declarations of emergencies allow not only our federal government but our state and local governments to do.
How much of a burden or toll does this place on hospitals who are trying to serve other patients coming from non-coronavirus related things, be it I'm getting my appendix taken out, I've got a broken leg, anything else you might go to the hospital for?
So I think that's why the really key aspect are those social distancing and non-pharmaceutical interventions, because as was mentioned yesterday at our briefing, we are trying to keep the true disaster, which is overburdening our healthcare system, from happening. Now, as this progresses, hospitals might start limiting non-essential appointments or surgeries, partly to keep those bed counts available, but also to allow for flexibility with the healthcare staff in terms of serving the patients that have COVID-19. And so those are also the changes that hospitals are looking to implement across the board in the days to come. Again, right now we have 0 confirmed cases here in Peoria County, and so we are still in the pre-planning phase. But as this progresses over the next few weeks and months, we're going to see that transition and those type of decisions to be made across the board.
Next week we happen to have an election. What is being done? I think Scott's here someplace. I'm sure Scott would love to talk about this.
He actually does.
What is being done for the election in terms of keeping people apart, but also the people who are homebound, also the people who are trying to self-isolate? Because this happens so rapidly, is there time to get them ballots? Scott?
And I thought I was going to get out with it being asked any questions. Thanks, Andy.
I'm not going to let you out.
So the Election Commission does have deadlines in terms of when they can mail paper ballots out. Today, actually, they're out doing nursing home balloting, which is something that they do during every election cycle, where they go to nursing homes to provide the opportunity for those residents to vote. That's being done today. What the task at hand today also that they're really managing is election judges. Many of our election judges are of an age that they're in the vulnerable or at-risk population. And we've seen a number of election judges in an abundance of caution decide that they are not going to volunteer as election judges on Tuesday. And so Tom Bride and his staff at the Election Commission have been working to try and fill those voids throughout most of the day today, and they'll probably be spending most of the weekend to do that as well.
So what about the people who may not be living in a nursing home? For instance, I got a call today from a person who was self-isolating. She's a young person. She's in like 40-ish, and she's home, and she doesn't know how to vote.
Part of the challenge of this evolving situation is that we've got to balance those public health concerns and needs with what the election law says. And the election law doesn't always allow for the Election Commission and other election authorities to be able to go to someone's house in the situation that you're asking about, Andy. In large populations such as nursing homes and long-term care facilities, we do have provisions for that. But for individuals, right now, today, at this hour, that's an issue that Tom Bright and the team at the Election Commission are working to solve and don't have an answer yet for.
Scott, is there any talk about postponing the primary on Tuesday?
At this point in time, the election is going to go on as scheduled on Tuesday, absent action by the governor. And we've heard zero inclination of that happening.
Question for the county health department. Will there be another press conference of some sort tomorrow or Sunday?
I think as this progresses, if we don't have any large changes in the next 2 days, we'll resume this daily briefing on Monday. And then with that note, this room is set up for elections and it's polling center, and so we will be moving our press conference into LL 100, which is the lower level of this building, on both Monday and Tuesday, both for the election day as well as for the setup process.
There are still kind of some St. Patrick's Day events that are still planned this weekend that might get a good amount of people there. Is there any talk about shutting those down or keeping a closer eye on them?
We have been working closely with our businesses as well as our Visitors and Convention Bureau to make sure they're pushing out education as well. The biggest thing that we'll tell the public about these activities is that if you are a high-risk individual, you should really try to avoid these type of settings. Again, because we are still in that preparedness phase, there's a lot of understanding from the individual standpoint, your risk that you can when you come into activities of this nature. But overall, we have limited to large venues, over 1,000. They're closed. For example, the Farm Bureau will not be hosting their Farm Share breakfast, which is a great educational activity where they were able to show how farmers support our communities day in and day out. And they do a wonderful job, and they are looking to postpone that. And so we appreciate agencies such as the Farm Bureau that take on those initiatives for the well-being of our community. Well, thank you all. I think the governor is going to be making his announcements here at 4 o'clock, so we will wrap up for today.
The regional superintendent that serves Peoria County. We have 18 school districts and 1 special education cooperative that were just told by Governor Pritzker that we will be closed for business from March 17th to March 30th. I think the state superintendent, Dr. Carmen Ayala, said it best. These are unprecedented times. However, in Peoria County, we have a group of superintendents that have been working together on safety, as you know, in public education for quite some time. We have had many crises that we've had to deal with, from school shootings to weather to things such as that, and something such as this, while a part of it, adds a whole new twist. So we've been meeting on school safety, and we have brought in the health department. Jason Marks from the Emergency Management Agency has been meeting with us on a regular basis. Monica has only been a phone call away, and we have been trying to give up-to-date information to all of our school districts. They have been preparing, but they've been preparing for e-learning days or a possible few days off. Starting today, they started to put together some plans for what happens if we are out for an extended period of time. That looks very different. So closing school, if you're a school administrator, is a double-edged sword. We do need to protect and flatten the curve, but our number one priority is the safety of the children. So we have been putting together contingency plans around feeding the students, keeping them safe, thinking about childcare, and what happens when we come back. So there are a lot of things like that going on in the districts, but I do want to let you know this. Those are all local decisions. As regional superintendent, I can only offer suggestions, I can offer information and advice, but I cannot give them an edict or tell them what they need to do. So each superintendent is meeting with their local school board and their staff to determine what steps that they need to take from here. I'm seeing a lot of questions around why Tuesday? Why not go now? I'm hoping that's because a lot of staff and students who've already left for today, they need to get their things. We need time to prepare. We have to take care of these children, and so we need that extra day. And with that, I'll take any questions that you have.
how prepared are Peoria County's 18 school districts to transition to e-learning for this extended period of time?
E-learning is that other double-edged sword. So when it comes to e-learning, you have to think about who has access to a device, who has access to Wi-Fi, and in some of our smaller rural districts, do they even have the broadband to have the capacity to do it? So e-learning is a little bit of a misnomer. You can also have a packet that you send home with the students. Districts have been gearing up for that heavy duty once the virus hit. So we had several school districts that submitted their e-learning plans, and I've approved those so that they can move forward with that. But what we don't know is that, what do these days look like? We're waiting for that information. You heard him mention some of those groups that are meeting to determine, do we have to make these days up? I don't know. So we're waiting for that information.
So there's a lot of uncertainty currently. I mean, what are the superintendents across the county telling you right now? I mean, are there some who just say we're not prepared at all, or is it kind of we're taking it as it goes? I mean, what's the general mindset or feeling right now?
Well, the information changes by the hour. So they have been preparing, every single district, because you saw it start to happen across the country and in different districts earlier this week. So they have definitely been preparing and getting their staff ready.
One of the things that you mentioned is that when you talk about the school boards, you're obviously talking about the public school. Are there any rules for private schools?
I do not have any compliance abilities with a private school, so private schools do follow their own rules, but the governor did say that public and private, and the diocese in Peoria had already closed the schools.
Right, but what I guess I'm asking, are you having any conversation with private schools?
They have been included in all the information sharing about the virus, but we have not discussed with them about moving forward. They have their own e-learning concept.
Okay.
I know in the state press conference they discussed, trying to get plans in place in terms of trying to feed these kids that, would normally have food provided to them. Locally, are there any plans in motion? Can you go into detail about that?
Yes, we're talking about the food truck concept. So we have lots of staff that will now be available to help with these meal deliveries. We're looking at how do you use the bus and the bus driver. How can you utilize your agencies here in town that would have access to a van or something like that that could help deliver? So at this time, school districts are thinking about what could be a pickup point. Do we use a bus route? What does that look like? They're preparing that information, and thankfully we have Monday to get that information out, communicate to parents so that they're ready. So that's the concept that we are looking at.
And then they also mentioned in the state press conference some food banks being involved. Do you know if any in Central Illinois are involved in this?
I do not know at this time.
So it sounds like the teachers will still have a lot to do, even if they might not physically be in class. Can you just talk between, preparing lesson plans online to even, driving or working on these food trucks? Can you talk a little bit about what they'll be doing during this time?
Well, if any teachers are doing e-learning, that is going to be handled through, if you've ever heard of Google Classroom, that is a live touch point where teachers can answer questions, deliver materials to students, grade papers, submit things back and forth. So there's the e-learning component, but the big one is professional learning. So they can do all kinds of things through video conferencing, Skype, etc., to do a lot of professional learning. But again, this is unprecedented. So we have to think about, what do the teachers' unions, what are they going to be working, not working? What about non-essential or non-teaching staff? What do they do? So we are working through those things in those task force. I'm hoping that the governor has assembled will help us with that.
Is there anybody local on that task force? Or are you on the task force?
None that I know of.
Okay.
Obviously, the most important part of school is the learning, but there's so much more than that. I guess kind of your statement too, we saw it first with a lot of the high school sports tournaments being canceled. Now, with this happening, you're talking about musicals, bands, orchestras, field trips. I guess just kind of your reaction to this and the impact that it might have on the students, psychologically.
If you don't mind, I'd like to take a moment to stress that there's a lot we need to figure out with this. There are a lot of logistics. But if we could just take a moment and recognize the mental health piece of this, it's devastating. When they canceled the tournament, if you go out on any social media feed and see some of the students reporting what it was like to work their whole lives to get to that point. I was sharing with a few that my daughter's a senior in college. I didn't know that I saw her last track meet. And those are things we savor. And those are things that are rewarding. And when all of a sudden those things are gone, and now you spread that out across an educational system, you only get to be a senior once. So those are things we need to think about, and we need to talk to one another about those mental health pieces, accessing hopefully those call-in lines with your employee wellness if you need a little bit of support. So our families are going to need that as well. And when they come back to school, school is a lot of routine and getting used to the routine. And if we're going to send them home for some of these kids for what's an extended period of time, what's that going to look like when they come back? And it's the end of the year anyway, so helping them transition for the end of the year.
Speaking of mental health, I mean, I don't know if you know the answer to this. Does this also include things like District 150's like wraparound center, for instance?
I'm hoping that they're going to mobilize some services out of there, but again, we're trying to keep people at that social distancing. So we don't want to converge large groups of people, but is there a way they could access that? So hopefully they're working through those things as we speak.
So I know we're not sure, when we'll come back, like you said, a lot of unknowns, but we do know that, the governor said limiting those large groups. And, when we think of large groups, one of the big things, you just touched on it with seniors graduation. Any talk locally about what graduation would look like or anything about that? With
a March 30th deadline and a reevaluation at that time, there's going to be a lot of consideration then about the other big events. Prom, graduation, all the big things for the end of the year that families enjoy and that they celebrate. But public health comes first. And so we have to embrace that, and we have to embrace the fact that we're trying to flatten that curve, that we need to not stress our healthcare system, and that takes precedence, and that hopefully we can find a way to bring in those moments of joy and those celebrations when we can.
And then if you could elaborate too how this will be hard on parents, that may not be able to stay home, and talk about how districts might be able to help with that, or if there's anything they can do.
Oh my goodness, I have 2 college students that I thought were going back and are with me now for a few weeks that I have to feed. When it comes to parents needing to, I am extremely worried about how do you provide childcare if you're an hourly worker, a multiple part-time job employee, and you need to be at work. We're going to have to support one another. It is going to take the entire village to support these families and these children, because you don't want them in a large setting. So it doesn't make sense to close school and then recongregate at a camp. So we have to look at those options and how can we reach out and support one another. And it may not be best at this time for grandma to be watching them. So it's looking out for those kinds of things, and then it's going to be on the employer side to help support that as well. Childcare is a big deal.
If I may, we do have, I think a lot of information is required, a lot of communication, understanding what resources are out there. And so at this time, I'd like to actually introduce the CEO of AMT, as well as the county board chairman, Andrew Rand, to talk about how the role of 211 is in this type of event.
Thank you, Beth. Absolutely. You're the best. And everything she says, does this all look normal still? You're breaking my heart. I know everything she says she means.
As long as it's not correct, it looks like it's okay.
Does it look like what?
It looks like it's okay. I've got a recorder underneath.
You do? Okay. I thought you didn't like the Apple logo. Okay. So a couple of really important things here. First, with the emergency operations plan that's underway being managed by the director here, I think sometimes I forget to call her the Administrative Public Health Department. We have mobilized an army of individuals and organizations through the health department's coordination of this emergency operations center. It's really important on some level that everyone understand that the general, if you will, I referred to her that yesterday, has organized hospitals, labs, our relationship with the Illinois Department of Public Health, the media, the community, first responders, and even things like 211, because they planned in advance for things like this, where people across broad sectors and disciplines would have an organized way to know what's going on. In the news today, not only from Washington or the governor this afternoon, is a little bit difficult for people to digest, but I know that we will continue to do the very best because of the kind of people that we have in charge of this, including Beth Kreider, I'm trying to say her old name, and Monica here at the Health Department. On another note, because we're trying to manage the same information across multiple platforms using the power of what area technologies there may be, Code Red is a utility that the Emergency Communications Center, what you think of as 911, in Peoria County has enabled to distribute very quickly the same information to thousands of households and cell phones in the county. Code Red also comes in an app that you can install on your mobile device. You can register your mobile device to receive messages. And of course, if you have a landline, you're going to get one anyway. But because Code Red also can influence using text messages all the cell phones, whether you're registered or not, because of the importance of the message, we'll be using that tomorrow to help coordinate people who just aren't getting the news from a press conference or aren't getting the news from television about how the local community is prepared to do something and what they can do for themselves to gather some information. So tomorrow at 10 o'clock, we will issue a Code Red message across the community that is very concise. Dr. Greg Stoner, the medical director for the Public Health Department, is the author of it. It will direct folks to the state of Illinois' coronavirus hotline, as well as all of the websites, beginning with the Peoria City County Health Department, the Illinois Department of Public Health's website on coronavirus, that particular page section, of course, the CDC. That message is designed to help people simply make themselves more aware and self-learn so that this does not become either a crisis for 911. And we're also connecting through that message our 211 call center here, which actually impacts 6 counties here in central Illinois, including Peoria County, with the ability, if they want to call 211, either using a 10-digit number, which will be part of that message, or the simple 3-digit number, they can get additional information from some live operators, technical people. So that's what I wanted to let you know. The E911 system will send a message out. It will connect folks with various resources, including the local 211, and that'll happen tomorrow. Thank you.
Again, we hope to see you guys again on Monday. I think we're back to the original time, as Diana Scott has sent out as well. Thank you all.